Hi, everybody, and welcome to another episode of the Beauty Outlaw. And I have a special friend, I want to call her. She was one of my first guests on the podcast, and it's Kayla. She came on entrusting me, not knowing me from anyone, but entrusting me to sit here on a new podcast and be interviewed by somebody who never really interviewed anyone. And she was great, and she has so much value to bring to the world of aesthetics. So the world of aesthetics is, it's the Wild West. And Kayla, you're a PA. And if I want to urge you all to go back to the original episode with Kayla, because she shares her amazing story of how she became a PA, how she moved to California, how she started her practice, and what it looks like now. But we're going to find out what else she's been up to. Kayla has grown a lot. Her practice is in Temecula, California. It is really successful. It's because of her. She's a team leader, and I want to ask her a ton of questions. The first one is, I want to welcome you, Kayla. How you doing?
Thank you. I'm so good. Great. It's good to be here again.
I'm glad you're here. And we've chatted back and forth. And unfortunately, or fortunately, the beauty of social media is you can kind of stay in touch with people you don't get to talk to every day.
I know.
And see what they're up to.
I know. It's hard to keep in touch for sure, especially when you're running a business and a podcast. So
yes.
It's definitely difficult.
A business, a mom.
Yes. Yep. A mom to a beautiful 4-year-old little girl.
She's 4.
Yeah, she's 4. She's
happens
so cute.
quick.
It does. It happens so quick, but she's the reason why I do what I do. So.
And you're married.
Married. Gosh, we've been together 18 years.
Oh my gosh.
It'll be 19 years this month. So.
Wow. I didn't realize you guys were together that long.
Too long. No, I'm just kidding. I love him very much, but it's been a long time.
18 years is like, I hate to use this word, but that's like almost sibling territory.
Oh,
it's true family.
It's true family. I've lived with him longer than I lived with my own family. And when you think about that, it's kind of crazy. So, but no, we've been very blessed in our marriage and in our family.
So did you guys meet in college then?
Yeah, we did. Yeah.
Wow.
Well, he was already done. I was in my senior year, and I was not looking to settle down then, of course. That's when it happens.
That's when it happens.
So.
And obviously, you didn't get married because you became pregnant.
No.
Which is okay, too. We're okay with that. But it was much later.
Yeah, much later.
And you guys are originally both of you from Arizona?
From Arizona. He grew up in northern Arizona. I grew up in Scottsdale, Phoenix area.
Oh, you're a snooty girl.
It's funny. I grew up in the country part. It's funny. Everybody thinks that. But no, I was in the country with horses. We had an arena. We had a barn. We had all that. So a little bit different.
Which brings you to Temecula, California, because it's got a little horse country.
I'm actually
out there.
From there originally. And then my parents moved us to Arizona. And then when I lived in Temecula, that's where I learned how to ride horses. It was all English riding, though. I moved out to Arizona, figured out what a horn was on a saddle real fast. So a little bit different riding technique out there.
I love it. You're an official beauty outlaw.
I know.
Sitting on that horse with a cowboy hat. Okay. So I know people have questions, because I do. And I know the questions I get asked all the time. And me headed towards my nurse practitioner, getting my family nurse practitioner license, FMP license. In our industry of aesthetics, or even in medical, people have questions. So Kayla is a physician's assistant, and there is little bits of differences, especially when it comes to California law. So we're going to talk a lot about California law, but a physician's assistant, explain your scope of practice, how you go to school, what it looks like, how long it takes to get through it. Kind of give us a brief overview of that.
Yeah, so a PA degree is a master's degree. I received mine from Western University of Health Sciences in Pomona. You can become nationally accredited or just state accredited as well. So
is that after you've graduated? So
after you've graduated, you take your boards.
Okay.
And then through the NCCPA, you can become accredited there.
Okay. Is that the C on the end of the?
Yep.
It says PAC?
Mm-hmm.
Okay.
That's the C. And then after that, you can practice. The cool thing about being a PA is you can switch fields. So let's say you want to work in dermatology or ER or surgery. You have the option, as long as they're going to provide the training to you, to switch fields within medicine, which is very nice.
That is really nice.
Yeah.
That is a bonus.
So you don't have to complete residencies or fellowships over and over again. So that's a huge bonus in this field. And there is autonomy with it. You're able to diagnose, prescribe medication. You're pretty much doing everything your supervising physician's doing. But you are required to have one here in the state of California. You need to have a physician oversee your medical care as well. So,
is that what about corporate practice of medicine? So, in order to function as a medical practice, do you have the same scope as a nurse practitioner or RN does, where you have to set up a corporation that is 51%
yes.
owned
Yes.
by the doctor and 49% by the PA or the nurse or the nurse practitioner?
You absolutely have to do that. Now, there are caveats to that. Sometimes people will set up a separate corporation on top of the medical corporation, and then you can have full ownership of that.
Called an MSO.
Yep, exactly. And that's obviously done by your attorney that you hire. But
That you should hire.
That you absolutely should hire before starting any business and negotiating any deals with your physician that you'll be alongside, because it's super important to have that clear in writing, and definitely don't deviate from that. Get the attorney ASAP. So
how did that look, and how important is it to have a business partner that's a physician that's actually your business partner?
Well, I got really lucky with mine because we knew each other well before going into it. So we both worked in emergency medicine at Temecula Valley Hospital, and we worked well together. And something that I knew was important to me, because my family had been in business before, was just finding somebody who had integrity and who was honest. So they may not be a hustler as much as you. They may not be, they may be more charismatic, not as charismatic. Those things you can work around, but you can't work around integrity.
No, you can't.
You have to make sure whoever you partner with is honest with you and direct with you. And that's something me and him have been always very good about.
That's great.
Yeah.
That's great. And I believe he's actually works within the practice that you guys have built as well, right?
Yeah, so he's there on Fridays, but he specializes in hormones. So, yep, aesthetics isn't his jam.
That's your jam.
That's my jam all day. He loves hormone replacement therapy, and that's where he likes to focus.
I love that we need more hormone people that know hormones and not these online punch in your information.
Oh, that's so scary.
This is what I want to get into, because I'm passionate about hormones. They've completely been the shame and the shade behind all that, keeping women from doing hormones, and men. Men are more accepted. They're allowed to do testosterone. It's always been like that. But women take a back seat. And some things have changed in the industry. And what are those that you've seen? Like when it comes to like clinical trials that have allowed us to kind of
I think people
expand our scopes with that.
It's not just even the clinical trials. I mean, they redacted that false paper that came out saying that it would cause breast cancer and all these other fallacies that we have redacted, and they removed the black box warning off of.
But people don't know this.
No, they don't know it.
Including providers.
Oh, well, they should. I don't know what to say there.
I know, but I'm telling you.
Yeah.
They're still practicing like that, to what I think it was 1999 Women's Well study.
Yeah.
That was done. There are people that are still refusing, OBGYNs that are still refusing giving women hormones.
And I'm seeing a turnaround, though, because I go to these conferences every year for the hormones, and I'm seeing more and more OBGYN and urologists. They're sitting right next to me at these conferences doing their due diligence and their research for it, because unfortunately, as women, I think we just think we're supposed to have babies, take care of them, and then we're done, right? We don't really focus on our health. We focus on everybody else, our families, before ourselves. Well, finally, with this day of medicine, we're concerned now. We feel fatigued. We feel tired. And we lose half of our estrogen by at least 35. We lose another half of that half by the time we're 42. And, of course, we're run down. We're tired. We're fatigued. Then we go through perimenopause. And it just doesn't get better, and we're told to deal with it. Meanwhile, your husband or your spouse is out there getting testosterone injections, living his best life.
Yeah.
And unfortunately, what drives me nuts is insurance will pay for a lot of that. Not for everybody, but for a lot of men to get their testosterone replacement and not women. So hopefully with the study being redacted, with more and more women focusing on their health, getting hormone replacement therapy, insurance companies will come on board with it. But that's a dream right now. So.
It is, but there's also some interesting things. My friend, she's an OBGYN, Dr. Maria Keller. She just took recertified. She's been an OBGYN for years. And she said she was because hormones are her life. Sexual wellness is what she specializes in. And she said she was so pleasantly surprised that on the boards, there was actually positivity in the answers when it came to women's health on hormone replacement therapy. So we're moving in the right direction.
Yeah, there should be, though. I mean, it helps bone health. It helps prevent dementia. There's so many benefits to it. It's not just about sexual health, which is where I think it gets a bad rap. There's just so many benefits as far as longevity-wise, feeling good. You know.
We're living longer.
Yes.
So we need to live well. And it does help us with our, like you said, our bones.
Yep.
It helps us with dementia.
Yes.
In our brains. And just overall feeling of affection and nurturing that can go away as we age, as our estrogen tanks. Yeah. And we're left with that evil estrone. Which is, I go through with a lot of my patients when I try to explain them. I explain the 3 evil pieces of estrogen, and we're left with this one that just leaves us in the corner at a bar dying. I like to call her Samantha from Samantha from Sex and the City. You don't want to be left alone without Carrie or the other one, Charlotte. Because if you're just with Sam, you are going to end up in the corner of a bar. Who knows what's happened to you? Anyways, that's just my...
But it's kind of funny, too, is also think about perimenopause and how you're feeling and how your sex drive is in the tank. You don't feel as good. Your emotions are high. Think about how many divorces happen during that time frame.
Absolutely.
And like I said, I've been with my husband a long time, and I felt those symptoms, and it's real. So take care of yourself, your health, be cognizant of it, and talk to your doctor about it. And if they're adverse to hormone replacement therapy, then I urge you to select another specialist who will have those conversations with you.
Yes. Definitely get a second. If you have to, get a third opinion. Hormone replacement, if you're in Temecula. But it's true, if you're in the area of Southern California and you need a good provider, somebody that has experience as well.
Yeah.
You know, you guys do that. You said that your provider.
Yeah, so we use BioTE nutraceuticals is how we do it. But I think...
So you guys do the pellets.
We do the pellets. Dr. Solomani does the injectables for men as well. I don't do that. I focus mainly on women's health, and I love the hormone replacement therapy as far as the pellets are concerned. I think it's really beneficial and lower risk. But it's not an overnight fix, though, either. So there's a lot to it. You need to check blood work. You need to check their past medical history. Make sure they are a good candidate for it. Let them know this isn't going to turn around the next day. It takes a while to figure out what the correct dose is, what their therapeutic dose is. It may be different on blood work versus how they're feeling, what safe parameters they need to be in. So there's a lot involved with it. So give hormones a good year. It's a relationship for sure.
Because like you said, you're asking people how they feel because that is very important.
Yeah, that is. Their lab work could be perfect. Their T could be at the 120, and they could be feeling terrible, but at 180 they may be feeling like $1 million. So you got to figure out, do those health assessments, figure out how they're feeling, and then dose them correctly based on that.
And find a good provider that will practice individualized care.
Yes, that's huge. Who will take the time. That's another thing. I always do follow-ups, and I do follow-up labs, and I sit down and I do a secondary assessment to make sure that they're feeling great. Half the time at a lot of these, where they just go in, shoot you up, and you leave.
Yeah.
They don't really check how you're feeling, and they don't base your dose on the assessment. They're just following a protocol. So you could be feeling too high and having opposite symptoms where you're just super emotional, hair loss, acne, and you're like, what the heck am I doing? And then, or you could be too low where the effects really aren't taking into effect, and so they need to boost you up a little bit. So I really do personalize your dosage based on how you're feeling in your lab work.
I love that. I like that you do it like that, and you're very specific and specialized, especially with the women. And then you said that your business partner really, really focuses with men. And I've noticed with men, I have a lot of male clients. They also so then you've reached that stage in your life where you've made it through. You've been married 35 years. Your kids are gone. You're a woman, and you're postmenopausal, because you've never really been supported with hormones. Your husband's still has testosterone, but his is lower, and you're unable to meet each other's needs. And men, as their T drops, I've noticed, they kind of become a little insecure too if they don't get attention from their wife in that sexual way. So there's nothing better. Do you guys do like a lot of spouses?
We do. I always warn people because it's usually the wife who comes in first. And I'm like, hey, prep your husband that you're getting this, because he's not going to keep up with you. And the husbands are always hesitant at first, but it's 6 weeks later, they're in my office and I'm treating them. So make sure you're both on the same page with your hormone replacement therapy.
So great. Because you can just live that. There's nothing like looking at your husband in the face like you did when you were 25.
Oh, absolutely.
And you're like, oh my God, it's just, it's better than holding hands.
Yeah, life's meant to be fun. It's meant to be intimate. You're supposed to love your spouse, date your spouse, and have those cherished times together. Absolutely.
And so I like that you guys both come from both angles, and he specializes, it sounds like, in injectable testosterone for men.
Well, he does both. He does the pellets too, but he does do a lot of athletes, and they prefer the injectables.
And the injectables,
yeah. It's a little bit harder when their body fat percentage is on the lower end. Not that you can't do pellets, but they definitely prefer the injectables.
Can you explain pellets, not to freak anybody out, but kind of explain the process.
So the pellets, they look like tiny little Tic Tacs, and they're actually made from yams, and they put the testosterone in the pellet, and then your body, you implant it. So you make a small incision in the buttock or the flank area, and then you implant it into that area using a little device called a trocar. And then the wound will heal up. You got to lay low for a few days, and then after it heals up, you're good to go.
So no exercise if you're...
you don't want to do a lot of glute exercise. Yeah. You can pop them out because there's an open wound there. So you just treat it like any wound anywhere else you get on your body. Now, the flank, it's less downtime. Obviously, you don't have a big muscle pressing on that area, so the risk of extrusion is a lot less in that area. But yeah, that's pretty much it. And then it absorbs in the bloodstream usually within a few weeks. And then you're good to go.
Can you share with everyone that it's not overnight? Sometimes it takes a little while.
Yeah, it does. Your body has to break down that testosterone that's in the pellet, and then you have something in your blood called a sex hormone binding globulin, and that's going to carry the testosterone into the bloodstream. And it takes time. It's not an overnight thing, especially if your T's been pretty low for a long time. Now, everybody's a different responder, just like neurotoxin. You have some people that respond in a couple days, some that take the full 2-3 weeks. So same thing with hormones. It could take effect in 2 weeks. It could take effect in 4, maybe even 6. So I always tell people when you're doing hormone replacement therapy, and if it's your first time doing it, give it a few sessions, give it a few rounds before Don't give up. And then see how you feel after that first year. And then after that first year, if you're like, it did nothing for me, then we can have a different conversation. But usually at about that year mark, people are loving their life.
And with pellets, so injectables are done weekly of testosterone. But the pellets, explain what that looks like to a patient. How often do they come in?
So usually women will come in every 3-4 months, but 4 months is pretty much the standard, just like their Botox. And it's very common for people to get their Botox and BioTE together. It happens all the time. And they're on a routine schedule and they just get it done. And it's usually pretty perfect at that point. Men come in every 6 months. However, if I'm doing a different pellet in men, like a T100 instead of a T200, they'll come in a little bit sooner at 4 or 5 months for that. So...
What are we're taking a deep dive into hormones, but there are some things that women are afraid of, especially women, and that is loss of hair.
Yep.
Can you shed some light on some side effects that are not necessarily the truth, and some things to watch for if you are taking testosterone or the whole components of all three, progesterone,
this is
estradiol.
why it's super important. You need to supplement when you're on your hormones. If somebody's not telling you to take things like DIM to help you support your estrogen metabolism, you need to be doing that. If you have a spouse that's not taking it, go pick some up and take that. But things that can happen, especially in women, is if we're not checking lab work and we're not being diligent about prescribing the right dose of testosterone, you can have problems of hair loss, excess facial hair growth. You can have mood changes. You can have voice changes if your testosterone goes over 300. And that can be permanent. You can have an enlarged clitoris, which some people don't complain about, but that's not a good thing if it happens.
No, it's not.
So you have to be very careful not to overdose your patient on testosterone, because once they're in there and they're implanted, it's surgery to get them removed if you want them removed before they're dissolved. So
okay, this is where an expert provider and somebody that's willing to communicate with you, individualized care comes in, because the time when I see the hair growth on the chin and the facial hair and the loss of hair, it's due to, unfortunately, those online or somebody that's just you're walking into a med spa that's just not dissing med spas, because that's our world, but somebody who puts a sign up and says, we do this. And I'm seeing a lot of people that aren't precisely individualized, and they're having major side effects. And it's hard to get your hair back.
Yeah.
Once you're a woman in your 50s.
Yeah.
You won't get it all back again. You'll have to do some other alternatives.
Yeah, definitely. Schedule the consultation, have the interview with the provider. Make sure you trust them. Make sure they've been doing this a long time, that they're experienced in it.
Experience is really huge in this.
And staying up to date, too.
Yeah.
How much do you learn when you go to these conferences? I mean, I feel like, especially with hormones, it's a whole nother beast. I've been a PA for a long time now. I've been doing it for a long time, and every single year I learn something new. And things change. I mean, it's not the same it was 5 years ago.
And guess who you learn from, too? Your patient that comes in that you have the relationship with.
Absolutely.
That's where you're learning, is because you're seeing them, you're giving them that quality, individualized care. You're learning, which just helps the next patient that you see.
Yeah, absolutely.
So I love that. I didn't know you were doing that.
I've been doing it for
a long time.
Yeah,
we didn't talk about that last time, because we were just talking about. I mean, I knew you guys did wellness and hormones, but I didn't know you were privy to that.
Yeah, I have myself. I have Dr. Clinice Pratt. She actually has her doctorates in hormone replacement therapy. She's only there 1 day a week. Would love her there every day. But she is, honestly, if you ever need to pick somebody's brain about hormones, she is your girl. She's there every Thursday, and then Dr. Soleimani as well.
We need more people like that to teach providers, because it is blowing up, which is so great. It is literally pushing things like face filler to the side.
Yeah.
At least in the 50 plus generation. They're now focused on longevity and how I can live well, long, strong, and vital, instead of, they still are interested in all that. But I'm just saying it's taking a little bit of a backseat, which I love.
Yeah.
Because overall health is so important, and feeling great.
And you want to feel good on the outside and the inside. So, yeah.
So I know that you're Miss Specialist Injector. You do a lot of injectables.
I do.
Neurotoxin, Botox, Dysport, Jeuveau. I'm sure you got them all there. No?
Nope, I don't do Jeuveau. I do Botox, Dysport, and Xeomin.
Okay.
Yep.
But then you do a lot of injectable filler volumization.
I love it. It's my favorite.
It's her favorite. That's what I was going to get to.
Injectable hyaluronic acid is my favorite.
And you have your favorites products.
Absolutely. Yeah.
Are you basically kind of, you a la carte it? So when you see the patient, you decide kind of what's best for the area that you're treating?
I do my assessments a little different, I feel like, than most people when they come in. Especially the first time meeting a patient, I block up an hour, which I know is pretty unheard of in this industry.
It's important.
But
glad you do that.
But it's super nice to I like to look at the whole face And I like to just be blunt and honest, exactly what they need. I do a full facial assessment, which I know people love to say that they do, but it's super important you take the time to do a full facial assessment. And then what are their goals at the end of the day? I map everything out that I want to do, and it may be a ton, and I don't expect the patient to do that right then and there in that seat. But it also gives them an idea of what exactly it's going to take to reach their goals based on what they're coming in for. I don't like to set unrealistic expectations that, hey, 2 syringes is going to solve all your issues. And we have those conversations, and I map it out. And then over the next few years, we try to achieve those goals.
Exactly.
Yeah.
You're in it together for a while.
For a while. And like I said, I don't want them to feel like they need it all right then and there. There's no pressure behind it. Even if they just start with the 1 syringe, they're going to be happier in the end than even with their neurotoxin, I feel like, if they just trust me to inject it and to inject it properly. Unfortunately, and I love our field. I think we have the raddest job on the face of the earth.
Which is why everybody wants to get into it.
And I totally get why. And I train other clinics and I see how they do it in other practices. But it's super important that you invest in yourself, the time, the training, and the education. And again, I do trainings all the time myself, and I still learn new things. But it's understanding the anatomy, where the fat pad is, where the placement is, product selection is key to get the outcomes that you're looking to achieve. Because unfortunately, I do see a lot of the times where patients are unsatisfied with the results from other clinics, but it's usually, unfortunately, because of the injector that injected it, not because of the product itself. So it's just proper training education is key.
It's also a lot of self-diagnosis. So it's like, I come in, I want this. I want it here. And this is the part that cracks me up.
Yeah.
I want filler here. Well, we stopped doing that in 2010. Everybody, we don't put filler there. That's a mistake.
Yeah.
If somebody okays that and does that, run. Get out of your chair and run, because it's not coming from there.
I agree completely. Yes.
It's coming from other areas like your preauricular area. You're falling forward. So this is what you do in your 1-hour consultation. You probably explain this to everyone.
Yeah, and I don't let them control the conversation. At the end of the day,
stop controlling the conversation.
Yeah, you're the provider. You're diagnosing what issues they have. When they walk out the room, I can say you need 7.5 cc's of your filler in these areas. I know exact amounts. I know which product selection I'm using, and I know what it's going to take. And I don't let them say, I want 0.5 cc's right here. When somebody comes in and they're like, I want half a syringe everywhere, I unfortunately tell them, no, I don't do it. I don't do half syringes because that's not going to work. So
bringing us to half syringes.
Yeah.
What about the people that want to take their rest home? Or they come in with,
no. Yeah.
This happens.
You know what else happens that drives me crazy? I could go off on this topic.
Let's go off.
Is when they're like, oh, my other clinic saved it for me. So every 6 months I use the other half of the syringe I didn't use.
That's a no.
That's a huge no, red flag. And don't tell me the name of that provider that's telling you that, because I'm probably going to report them. So that scares me. Yeah, you guys, it's not sterile anymore. You can't do that. Your risk
putting
for
this into your
infection is
body.
high. Yes.
Here you're worried about what type of milk you're drinking.
I know.
But yet you're willing to use an expired or something that's got bacteria in it back into your body.
Yes.
Stop it right now.
Yeah. And then too, I don't want to be negative about this in our industry, because I think there's a lot of negativity surrounding injectables.
But there's a lot of positive.
Yeah, and there is, but we should be uplifting each other as providers. Like, I love this podcast, for example, because you're uplifting the community, right? You're trying to get us all in here having conversations that we should be having. Same thing in our market. I unfortunately, everybody treats it as competition because there's so many medical spas in the market. Yeah. And everybody's cutthroat and they don't want to talk to you. They don't want to be your friend. They don't want to have these conversations. But what are they going to take from you? Honestly, what are they going to take? If they take some marketing advice from you, then great. But you create your medical spa, not somebody else. You're not in competition with anyone else except yourself. So I really hope we foster a community that we can all get together and learn from each other.
It's so important.
It's so important, but so hard, isn't it?
It is. Yeah. You have to, because picking up the phone, I mean, even a decade things have changed even in the last 5 years. Even for me, starting this, I mean, I have so much access to others now.
Yeah.
I'm not in my little bubble anymore, my little private bubble.
Yeah.
I could pick up the phone and call you and say, uh-oh, I think, but I don't usually say that. But if I did, I'd be like, hey, can I get your opinion? I'm going to shoot you a photo. And you would gladly say. Or if something's out of my realm, I'm sending it to somebody else. I'm picking up the phone. I'm calling you. This is invaluable. It makes you elevated.
Yeah.
Especially in front of your practice and your clients.
And it's funny because people come up to me like they're nervous to talk to me about something. And I'm an open book. Ask away. Like, I'm happy to share whatever knowledge or questions, good or bad. Like, I'm here to support you, help you. And I hope to receive that in return. So, but it's so strange in our field that we feel like we can't all be friends and get along. However, I will say, when you go to these conferences with other trainers or podcasts, there are more people who've been around a little bit longer. They're more open. They're more accepting because
they're not as protective.
They're not as protective, and there is a little community there, but the community is open to everybody. So hopefully we can get past that and all support each other. And in turn, it makes our industry go stronger. If we're better providers and we're providing better outcomes, this industry is growing and will continue to grow and elevate your business as well. So be a part of the team.
Yes, be a part of the team. And I really feel like, at first I wasn't sure how I felt about this. So when I've seen this world grow and all these girls be interested in going to nursing school for this industry, and as it's blowing up in other realms, longevity practice, health, wellness, women's hormones, it's so much bigger than injectables. I am leaning towards, I see why we need to do, I believe it's in Sweden. They actually have a school that once you become a nurse, you specialize in this field.
We should absolutely have that.
It's
kind of
time.
crazy. Yeah, we need some sort of body that regulates.
Yeah.
You need some sort of CEs or some sort of hands-on training before you're administering these services, whether it's aesthetics or integrative medicine on these patients, because poor patient outcomes. For example, immunogenicity is a huge topic right now with neurotoxins. We created that problem, you guys, by treating patients too frequently, because a patient comes in and says, oh, I only have money to do my frown. I'm going to come back in 2 weeks and do my crows. And then I want to lip flip 2 weeks later. And then you're saying okay to these treatments, and then they're resistant to neurotoxin. But let's say they develop some neurological issue where they need that neurotoxin. If they're immune to the neurotoxin, they could be anywhere from 6 months to 5 years. And you created that problem by saying yes every time to that patient. So we really need to practice what we preach, do the right thing. We're practicing medicine and do the right thing for the patient every time, even if it's hard to say no, because we are a cash business.
We are. But gosh, I mean, it used to be just neurotoxin we had.
I know.
And a little Restylane back in 2005.
That's so true.
That's all we had. And now we have so many other options to offer people that they can holiday. It's just like your hormones or anything else you're doing, or peptides. You sometimes need to holiday it.
Yeah.
And that's what you should be doing with your neurotoxin. And if you find a great provider, they're going to be like, you know what? We're not doing this every time you want to. Oh, you can move your forehead again. That's another thing that drives me crazy, is the aging neurotoxin female. Okay, I'm one, so I can speak to it. Stop telling me how you want your forehead frozen. Stop it.
And it's not going to be frozen for an entire 3 months.
Absolutely not.
Yes.
And maybe you aren't capable of having it frozen because your eyebrows, your eyelids are sitting down low. You need your forehead, listen, ladies, to raise those lids so you can see. Okay, so go to a provider that knows what they're doing. This is evolved. Neurotoxin is evolved beyond the injection sites that you're trained by the by like Allergan, and they're a drug company. So they got their ability to sell to you on a clinical trial. So they are teaching you off of the clinical trial. We've gone far beyond that. We're off label. We're doing all kinds of great things.
And it's crazy because people get their foot in the door with neurotoxin, right?
Yes.
So when you're opening a med spa, you feel like you learn neurotoxin. Neurotoxin is the
hard.
hardest thing to do.
It's the hardest.
It's harder than filler. It's harder than microneedling, anything neurotoxin. Like, you're still going to have those difficult patients with the Spock eyebrows, with, you're not able to fully correct the area because they're always going to move. And you'll have more hand-holding with neurotoxin treatments than any other service in your practice. Yeah.
Especially since they're all experts in neurotoxin before they come in the house.
Or they've been to 10 others.
10 others.
They know how it works.
Repeat offenders. It's okay. You know we're talking about you. It's okay. We've all been there.
That's a red flag.
Total red flag. Okay. So what does it look like? Okay. So what do I need done?
Let's do
this.
Need done?
Injectables.
Oh my gosh, you're gorgeous. Beautiful.
There we go.
Yeah.
But what if I came in and I said, I want something? Would you do my lips?
Well, what do you love most about your features? What's your favorite thing?
Give me a consult right now. Let's see. What do I like best? I like my lips.
You like your lips. And what do you love about your lips?
Let's see. I love that they're fuller. They've held up longer because I've aged and I'm kind of falling, especially my neck, and I try to ignore it. And what I do is I make bright lips so you don't pay attention to my neck.
And now you say you're falling. Where do you feel like you're falling?
I'm falling here.
Okay.
Yeah.
All right. Do you want me to keep going?
Keep going, girl. What are you going to do for me?
Well,
she's giving me a mini consult.
Yes. So first, let's assess the falling aspect.
Okay.
And let's assess everything more lateral that's supporting the mouth and make those lips really shine, but by treating other areas first. So that's typically what I would do with you.
There you go. She just redirected me from doing this, which makes this problem worse.
Yes, exactly.
And she's trying to but a lot of people don't want to pay they think they can't see it. It's like, I want to see the injectable, the volumization, where, like, instantly. And you can, when it's done by the right person who knows what area of the face to address, whether it's the chin, whether it's the lateral. People don't expect that. Or the temples. People ignore their temples.
And you know what? Like, I know we're all in this, like, at the end of the day, to make money, right? It's a business. However, let's say the patient really wanted their lips and that's what they came in for. But if you did their preauricular area, their zygoma area, you lifted them up, the temples, then maybe you offer the lip filler free if they treat all those other areas. Make the patient happy when they walk away. Yes, it's a little bit more time and a little bit more money out of your pocket, but your patient will be so satisfied,
She
so
just
happy.
gave all of you injectors a pearl.
Yeah, do that. Take care of them. My thing is I don't know if you use it or not, but I think there's a product called Skin Vive out in the market. Have you used it yet?
Yes.
So Skin Vive is a hydrator. It stimulates aquaporin and glycerin coming to the skin, and it just makes your skin glow and look more plump. It's a super simple treatment. If somebody came in and they spent all this money on filler, I usually will throw
that.
Yeah, I'll add it in, and guess what? Patients are like, my skin's glowing. It looks so pretty. I'm getting all these compliments. That is such an easy little pearl that I do in my clinic that makes such a difference in their outcome. So if you have something like that, it doesn't have to be that per se. It could be anything else you want to do that would just be a boost, but maybe they're on the fence about. Throw that in for the patient if you can afford to do it and it makes sense financially.
Right. If you can make, and a lot of times nurses and other people out there that own, not just nurses, but providers that are doing this, you have a good relationship. You should have a good relationship with your big pharma. I call them big pharma. You should have a good relationship, and a lot of times they love hearing that you're doing that. Yeah. And they'll be more than willing to. Did you hear what I said, guys? You'd be more than willing to donate the product or give the product back. Yeah. So these are just little pearls that are very important. Plus, you're leveling up for your patient. Yeah. You're addressing skin issues.
Yes, exactly.
As well as, you didn't want to say it to them maybe, but you know, wow, they could use a boost. And if I could offer this, if they do the important things first, tighten them up a little bit.
Yeah.
And then give them some volume or some hydration with their skin. I mean, that's a powerful, you're not going to lose that client.
And
they're not going to go anywhere
nail
else.
on the head too. Lean in on your rep. Your rep works for you. So if you do good, they do good.
Mm-hmm.
And as a business owner, in the beginning of owning my own business, I don't think I leaned on them as much as I could for support. And I felt like I felt alone and I felt like I had no support and I was trying to figure it out on my own until one day I had this most amazing rep. Her name's Kim Russ for Allergan, and she is the reason I love Allergan so much. But she
just takes a great rep.
It does.
Really.
It takes a good rep. And she was like, Kayla, I'll partner with you. We'll make this happen. And as soon as I dived into that with her, my practice boomed. I mean, she changed my whole practice. And it really was because of the support of the rep. I've also had other reps that were complete opposite that I never see. Like, there are a couple companies that I would love to invest in. I would love to grow and build
They just don't show up.
They're not there.
Yep.
Ever. And then when you call them out, they're offended by it. So then you're like, okay, I'll switch companies. You know, not a big deal. It didn't work for a relationship. So figure out who the best rep is to help support your growth in this industry, because they are going to be your biggest advocate. And like I said, they'll succeed as well if you do. So,
and it's so true, being afraid to lean in, and whatever beauty part of the beauty industry you're in, that's what you lean in on, is that rep. I will, because you did a shout out. I have to give a shout out because for many years I was very timid to lean into a rep. I felt like I needed to be this high volume turnover spa, and that's just not true. No. And I leaned in. She actually forced me. Allison Fuller from Galderma, she leaned in on me pretty hard and in a very pleasant way, and she allowed me to believe and to rely on her.
Yeah.
And she has been a huge, thank you, Allison. She has been a huge support and foundation for my growing. And I appreciate it.
Yeah.
And I'm shame on me for not being afraid to do that so many years ago.
I know, but you don't think to do that.
You don't.
You just treat them like another sales rep.
Yes.
Which, unfortunately, that is their job, is sales, but they're people too. And they want to see you succeed and they want to see you grow. So develop that relationship. And if it doesn't work, then move on. Don't try and beat a dead horse. Is that okay
yes.
to say?
No, I beat a dead horse.
But don't try and do that. Move on to another company that will support and will help you grow.
Love it. So she's a value, and don't if you're an injector, don't try to look her up and ask her a bunch of questions too, because she's busy. But I bet you she's open to. I bet you're open to that in your local community if somebody needs advice. Or,
I love it when people reach out to me. I can name about 10 people who reach out to me on the regular, and it makes me feel good because I feel like they can trust me. As well as, you know, maybe it's people I've trained with Allergan in the past, but you can always ask your rep too. Send me out. I'm happy to do it. I love teaching. I love education. It's definitely where my passion was. We have a residency training program at Neomed, and we do a lot of teaching. So
what does that look like? So does Allergan send?
No, Allergan
people, or
doesn't.
Do you have your own
I have
separate?
my own with UHS. So
that's great.
Their family med program through UHS sends their family med, sometimes dermatology. I've had some radiologists along the way, but it's their rotating optional month that they get.
Fun.
And they just started first time aesthetics into their residency program. So Neomed is the first one to do that.
Wow.
I know.
That's exciting.
It's been awesome, actually. So.
Oh.
And you know what's funny is everybody thinks they're going to love aesthetics.
Yeah.
Oh, there you go.
40 hours
there
in aesthetics.
Go. Come on. Yeah.
I might do that for my preceptorship.
There you go.
I'm going to check it out and see if I can get you approved.
Yeah, you can.
You'd be okay with filling out the paperwork?
I will. I'm happy to do it. I'm happy to do it. That's so funny.
See what relationships do in this industry, and also not being afraid. You've got quite a few people in your practice.
Yeah.
Not being afraid to just say, hey, I'm great at this, but I'm going to refer you out. Collaborate
Yeah.
with others within your practice or outside of your practice.
Yeah. I
important.
know I'm not the expert in everything. I mean, I tell people that up front. Like Lenise, for example, and Dr. Soleimani, they are the expert in hormones. I'm good at it. I know a lot of it, but I am not the expert. When it comes to hyaluronic acid injectables, neuromodulators,
She can call herself an
biostimulators,
expert.
I'm pretty good, right?
Yeah.
Like that's what I do. So I have a wait list for that. My patients love me for that. I have great outcomes. I'm very safe and very thorough, but I'm not the best in everything. So that's why you always have resources available in the community. And I'm happy to answer any DMs if you're on social media. So
Also practicing and having an expert that you can reach out to.
yeah.
So if you start something new, that's wonderful. I think it's great because I started somewhere. Everybody starts somewhere. But you need to be able to have that expert that you can call.
And there's some people that you ask and they don't respond. That's okay. Don't get offended. I mean, there's been a couple of people in this industry I've reached out to and I didn't get the response I was looking for. Don't be offended though. I mean, they are so busy. They've got other things on their plates.
And who knows how many people reached out.
Exactly.
Yeah.
And nobody's here hating on anyone else.
No.
That's not the case at all. Just take the time, reach out, and I'm happy to respond to anybody that does reach out to me. So, and I'm learning too. I mean, there's all this PDGF controversy, and people are getting crazy about that. And I'm a proponent. She's probably not. We could probably get in a little fight here. But
No. Explain to everybody what you're talking about.
so there's non-human derived platelet growth factors.
Yes.
So they actually use it. It's FDA approved for surgical reasons, wound healing. They use it in diabetic wounds. They were able to figure out like, hey, we see some neovascularization going on. We see some hair regrowth. I wonder if it works in aesthetics. And so last year we received it on the market and we have been doing it. However, there are people doing it without proper research and there's not a lot of data or research on it aesthetically because it is so new. So it is the wild, wild west where people are just injecting it maybe intradermally where they shouldn't and they're getting nodules. But I think we are practicing medicine.
We can't forget that.
We can't
You're
forget
right.
that. And it is proper placement on periosteum, in my opinion. I have done it in my practice.
right on
I've
that.
had excellent outcomes with it, but I am very, very careful and I'm very conservative with that treatment modality. And I blend it a little bit differently. So a lot of controversy with it.
There is. Remember Sculptra? I mean,
Oh my
20
gosh,
years
yes.
ago, the nodules.
Yes. And then we changed the dilution
Yes.
and nobody gets a nodule anymore. So, but then I went back to the old dilution to do it on bone too. So that's a whole different conversation too.
See, we don't even have to argue about it. I think it's great.
Yeah.
That's the thing is as long as some of the quality care providers and experts, it's in their hands, everything like that makes me feel better.
Yeah.
Because at least we have the safety
Yes.
first of the patient and the informed consent that we're not all sure how this is going to turn out, but it's for the common good in the future.
And it's
it will
not
work out.
FDA approved for
Right.
aesthetics. I understand that. I get it. But neither is velour in the lips.
No.
And we all love to do that. So you've got to be careful what you say because you may not be practicing what you preach either.
It's true.
So
It's true.
Yes.
No, I'm all for new things, and I think it's exciting, and I love that you're part of that.
Yeah.
I didn't know that.
Yeah.
That's
Tear
great.
trough and hair growth is what that's all I've done so far though. But tear trough's been amazing, but it's a slow roll. It's not an overnight.
It's not an overnight.
It's not an overnight. It's just like any other biostimulator.
It's going to take time.
It's going to take time.
Love it. She's been a wealth of information. Is there anything you want to share with us? What's going on new out at your place? What are you guys doing that's besides what you just shared?
Lots of training.
Doing the
Residency training. Yeah, I've been doing that for over a year now.
You mainly have PAs.
No,
And
all
you got some-
MDs. Oh, you mean
You got
for
MDs,
the residencies,
your staff.
MDs. Staff, I have 2 nurses. I have 1 PA. I'm a PA, and then the doc. So,
Okay.
yeah, and then we're looking at expanding a little bit. So hopefully I'm going to be growing my practice, but more on the educational side in Oceanside.
Okay, so this is going to be a different facility.
Yeah, I've been
Altogether.
actively working on it for a while now, but we'll see what happens.
Okay.
And then I've been training a lot for Allergan.
Okay.
So that's, I applied for the MD Codes mentorship. I did not get it. I was so bummed, but
Come on, guys.
I know. No, there was good reason. My hand blocked the camera, and you can't do that. So I was number 20 though. And they chose 16, and there was 50 applicants.
That's an honor.
That's
an honor in our world. That's an honor not hardly anybody makes.
But
so congratulations
the cool thing
on that.
I got to apply.
Yes.
And like I said, I'm always trying to learn. So it was a good opportunity to learn, critique myself. You don't really see what you're doing until you see it back on camera. Oh. And you're like, oh my gosh, like that's kind of crazy. I may have contaminated, So
our little habits,
yes,
right? And
absolutely.
They have to be pristine when you're in front of that camera training.
Perfect. Yeah.
Absolutely perfect.
Yeah.
Gosh, it's okay.
It's okay.
How many people don't next year?
Yeah,
We're going to do, I'm voting for her. There's something called editing.
I know. You can't edit though. That's the problem.
That's right. It's just straight through.
It's just straight through.
Yeah,
you got 2 minutes.
You got 2 minutes. Yeah. So this is quite an honor if you're in our field. This is quite an honor. If you're a nurse interested in this, or a doctor, it's quite an honor. So congratulations, Kayla. I'm so proud of you.
Appreciate
we
it.
have both just grown so much into we're like almost seniors in high school.
I know, I love watching you. It's so fun. It's a blast.
And we've both been around a long time.
Yeah.
So we're just keeping it real. And she's doing this because she wants to reach out and get in front of the camera. Even though it's a small group of people, we want to form a community, and that's what we're trying to do.
Yeah.
And with your help, you're doing it.
Let's
trying.
do it. I know.
You are.
I know.
You're amazing, Kayla.
Thank you. I appreciate you.
We have to do our toast.
Okay.
Though. We have to do our toast. Renee's going to bring us our little beauty outlaw. Somebody got me the cutest beauty outlaw.
Oh my gosh, who got these
Isn't
for
that
you?
cute?
Oh,
Lindsay, my office manager.
Isn't
that adorable?
Good job, Lindsay.
So cute, huh?
So cute.
Anyways, it says the beauty outlaw. And you guys know how it goes at the end. Champagne's my world, besides hormones. So, and lifting weights. Lots of things I do. As you get older, we have to do lots of things.
I know.
So, Kayla, you're a doll.
Thank you.
Thank you so much.
Yeah.
I'm so glad. She responds to me when I text her. So
I
so
told you.
excited. Okay, so chin chin.
All right, chin chin.
And we will see you on the next episode of The Beauty Outlaw.